Hello everyone, and welcome back to the show. It's so good to have you with us today as we tackle a very important topic. Before we dive in, I want to ask you for a small favor that makes a big difference. If you believe in the power of knowledge and want to take control of your health, please hit that subscribe button right now. By joining our community, you get access to life-saving information and become part of a family dedicated to wellness. It's your first and most important step toward a healthier you. You don't want to miss a single episode where we break down complex health issues and give you the tools you need to live better. Now let's talk about a condition that affects millions of people around the world: sickle cell disease. Imagine your red blood cells, which are normally round and flexible like little donuts. These cells are superstars, carrying oxygen all over your body, from your brain down to your toes. In sickle cell disease, something goes wrong with this process. The red blood cells are shaped differently. Instead of being round, they become hard, sticky, and curved like a crescent moon or a farming tool called a sickle. This different shape is where the disease gets its name, and it's the root of all the problems that follow. So, what causes this dramatic change in your blood cells? It all comes down to your genes. Think of your genes as the instruction manual for your body. Sickle cell disease is an inherited condition, meaning it's passed down from parents to their children. It's caused by a change in the gene that tells your body how to make hemoglobin. Hemoglobin is the protein inside red blood cells that is responsible for carrying oxygen. When this gene has a mutation, it creates an abnormal type of hemoglobin, called hemoglobin S. This faulty hemoglobin is what forces the red blood cells into that dangerous sickle shape. For a child to be born with sickle cell disease, they need to inherit one copy of the sickle cell gene from each parent. If you only inherit one gene, you won't have the disease itself, but you will have something called sickle cell trait. People with the trait are generally healthy, but they can pass the gene on to their own children. It's a powerful reminder of how our family's health history is written into our very DNA, influencing our lives in ways we are only beginning to fully understand. Understanding this genetic link is crucial for families to make informed decisions. When these sickle-shaped cells travel through your body, they can cause a lot of trouble. Because they are stiff and sticky, they don't flow smoothly through your small blood vessels. Instead, they can get stuck and clump together, creating blockages. This is like a traffic jam in your bloodstream. When blood can't get to where it needs to go, it can cause sudden, severe pain. These episodes are called pain crises, and they are one of the most common and difficult symptoms of sickle cell disease. This pain can strike anywhere in the body, like the chest, arms, and legs, and can last for hours or even days. Beyond these intense pain crises, sickle cell disease can lead to a constant feeling of tiredness, also known as fatigue. This happens because the sickle cells don't live as long as healthy red blood cells. Normal red blood cells last for about 120 days, but sickle cells break down much faster in just 10 to 20 days. Your body can't replace them quickly enough, which leads to a shortage of red blood cells. This condition is called anemia. When you have anemia, your body isn't getting enough oxygen, which can leave you feeling weak, dizzy, and out of breath, making even simple daily activities feel like a huge effort. Living with sickle cell disease means navigating a life filled with unique challenges. The unpredictable nature of pain crises can make it difficult to attend school, hold down a job, or make plans with friends and family. A person might feel perfectly fine one day and be in debilitating pain the next. This uncertainty can take a toll not just on the body, but on mental and emotional well-being too. It requires incredible strength and resilience to manage the physical symptoms while also dealing with the stress and anxiety that can come with a chronic illness. The blockages caused by sickle cells can also lead to more serious long-term complications over time. When organs and tissues don't receive enough oxygen-rich blood, they can become damaged. This can result in a range of health problems, including a higher risk of serious infections, vision problems, delayed growth in children, and even life-threatening conditions like stroke or acute chest syndrome. This is why it is so important for people with sickle cell disease to have regular medical care to monitor their health and manage these potential risks proactively. Now you might be wondering who is most affected by this challenging condition. Sickle cell disease is most common in people whose ancestors come from specific parts of the world. This includes people of African descent, particularly from sub-Saharan Africa. It is also found in people with heritage from South and Central America, the Caribbean, Mediterranean countries like Turkey, Greece, and Italy, and parts of the Middle East and India. This geographic pattern isn't a coincidence. Scientists believe that having the sickle cell trait actually provides some protection against malaria, a deadly disease common in these regions. So, how do doctors find out if someone has sickle cell disease? In many countries, including the United States, it's a standard part of newborn screening. Shortly after birth, a small blood sample is taken from the baby's heel. This simple blood test can check for the presence of abnormal hemoglobin S. This early diagnosis is incredibly important because it allows doctors and parents to start managing the condition right away. By taking preventive steps from infancy, we can help protect the child from some of the most severe complications of the disease, giving them the best possible start in life. For older children and adults who were not screened at birth, a blood test is also the key to diagnosis. A doctor might suspect sickle cell disease if a person shows symptoms like unexplained pain, fatigue, or anemia. The blood test, called a hemoglobin electrophoresis, can separate the different types of hemoglobin in the blood and clearly show if hemoglobin S is present. This test can determine not only if a person has sickle cell disease but also if they carry the sickle cell trait. Knowing your status is powerful information, especially for family planning. Genetic counseling is a vital resource for individuals and couples who have sickle cell disease or the trait. A genetic counselor can help you understand the chances of passing the gene onto your children. For example, if both parents have the sickle cell trait, there is a 25% or 1 in 4 chance with each pregnancy that their child will be born with sickle cell disease. Understanding these odds helps families make informed decisions about their future. It empowers them with knowledge, allowing them to prepare for what lies ahead with clarity and support. While there is no universal cure for sickle cell disease yet, there is so much hope on the horizon. We have more treatments available today than ever before to help people manage their symptoms and live longer, healthier lives. One of the main goals of treatment is to prevent and relieve pain crises. This can involve medications like hydroxyurea, which helps reduce the frequency of pain episodes and the need for blood transfusions. There are also newer medications that have been approved in recent years that work in different ways to prevent red blood cells from sickling and sticking together, offering more options for patients. Another cornerstone of treatment is preventing the serious complications of the disease. This often involves taking daily antibiotics, especially for young children, to prevent dangerous infections. Regular blood transfusions can also be a lifeline. This procedure provides the patient with healthy red blood cells from a donor, which helps to increase the oxygen supply throughout the body and reduce the risk of stroke and other complications. For a small number of patients, a stem cell transplant, also known as a bone marrow transplant, may offer a cure, but it is a complex and risky procedure that isn't suitable for everyone. The future for people living with sickle cell disease is brighter than ever before, thanks to incredible advancements in medical research. Scientists are working tirelessly on groundbreaking new therapies, including gene therapy. The idea behind gene therapy is to fix or replace the faulty gene that causes the disease in the first place. Early clinical trials have shown amazing promise, with some patients becoming completely free of their symptoms. While this research is still ongoing, it represents a monumental leap forward and offers the real possibility of a widely available cure in the years to come. My message to you today is one of hope and empowerment. If you or someone you love is affected by sickle cell disease, know that you are not alone. A strong community of patients, families, and healthcare providers is here to support you. I urge you to be proactive. Learn as much as you can about this disease, talk to your doctor about the best treatment plan for you, and connect with support groups. Knowledge is your greatest weapon. By working together, raising awareness, and supporting research, we can continue to improve lives and move closer to a world free of sickle cell disease. Thank you for joining me today.